Go ahead, First Lady.
Thank you. Hello, Congresswoman. We are ready to start when you are.
Thank you, First Lady. I am delighted to be here, and I want to thank you and your team for partnering with us as we try to bring our message from Washington to DC to not only inform you all and the whole state the things that we're trying to do, but to even recognize the leadership that you all have demonstrated already in this space. When we're talking about the care economy, we're talking about so many things, from access to good childcare, to supporting the childcare industry, to supporting those who work in that industry, to ensure that women and women of color in particular, who make up a lion's share of the workers in that space, that are treated with dignity and respect, and that the jobs that they do carry the kind of wages and support and standards that we think are important to the work that they do and who they are. And so got a lot of stuff going on. We're going to talk a little bit about what happened during COVID as a result of COVID and where we need to move forward. And I'm grateful for the partnership that we've had with you, First Lady, on so many issues, and your administration. It's just been absolutely wonderful to work with you all. And it's always a pleasure and a blessing to see Cecilia, because we've just been in this for so long that we know one another. We could probably finish each other's sentences. Thank you for having this. And I know you're going to introduce this amazing group of women, small group of women that you have on here.
So good morning, everyone. Congresswoman Watson Coleman, I am grateful for your friendship, your guidance, your partnership, and your absolutely vital leadership on so many issues that directly affect New Jersey families. I am honored to join this incredible panel of dedicated experts, advocates, and elected officials. We have so much to discuss, but before I introduce our esteemed panelists, I do want to share what New Jersey is doing to support our mothers and families, prioritizing those who work in the care economy, and how our work here at the state level aligns and intersects with the work that is being done on the federal level through the American Jobs Plan and the American Families Plan. Despite the unprecedented fiscal challenges COVID-19 posed to New Jersey, supporting our state's care economy has continued to be on the forefront of our minds. It has been a central priority of our administration since day number one, and the pandemic only made it more clear that investing in families is critically important. Over the past few years, I have been laser focused on tackling our state's high maternal and infant mortality rates, which disproportionately affect Black mothers and babies. In 2019, I launched Nurture New Jersey, my statewide initiative to reduce maternal mortality by 50% over 5 years and eliminate the racial disparities in birth outcomes. To end these disparities, we have to address the inequities and racism that have led us here. And that includes our social determinants of health, including access to high quality early childhood education, healthy, nutritious foods, affordable childcare, and more. There is no singular answer to solving our state or our nation's inequities. We therefore have made it our mission to tackle this problem through every available avenue. New Jersey is now a state that has pay equity, one of the most generous paid leave laws in the nation, and a higher minimum wage. We created and are working to expand our state's earned income tax credit and child and dependent care tax credit. We have continuously invested in early childhood education in every single budget. In fact, the governor's proposed budget for fiscal year 2022 includes over $900 million to expand, support, and invest in pre-K. And throughout the pandemic and even prior, we've sought to expand the affordability and access to childcare by investing in our subsidy program, cutting family copays in half, and more. This strategy is in lockstep with our partners at the federal level and supported by both the American Jobs Plan and the American Families Plan, which will provide access to support and programs ranging from universal pre-K to extending the earned income tax credit to low-wage workers, to nutrition assistance and maternal health, an issue which I have been laser focused on for more than 3 years. Through Nurture NJ, our administration has been hard at work figuring out how we can transform New Jersey into the safest and most equitable place in the nation to deliver and raise a baby. In that time, our understanding of the scope and causes of this crisis has grown immensely, but the most important lesson has been this: we can only succeed if we work together across a vast network of partnerships, and that's it, period. For this reason, we brought together experts from across the state and country to develop Nurture NJ's Maternal and Infant Health Strategic Plan, a plan designed to completely reinvent the way we care for pregnant women, particularly pregnant women of color. From growing and diversifying our perinatal workforce to establishing a perinatal episode of care to improving access to safe, affordable housing for pregnant and new moms, we are ready to lead the nation in this effort. We are doing more than just tweaking the problem with small improvements here and there. We are making real changes that lead to not just equality, but equity as well. This is the same spirit behind the American Jobs and American Families plans, and I'm thrilled that the actions we've taken in New Jersey to support our care economy will be expanded upon and amplified through these plans. Okay, so now I'd like to introduce the rest of today's speakers. From Advocates for Children of New Jersey, President Cecilia Zalkind is here. Ceil, welcome, and could you please introduce yourself?
Good morning, and thank you, First Lady and Congresswoman Watson-Coleman. It's so nice to be included. Thank you. I'm Cecilia Zalkind. I'm president of Advocates for Children of New Jersey. We're a state-based child advocacy organization with a very strong agenda in ensuring that children have access to high-quality care and education starting at birth. Childcare is a huge part of that agenda, and we have been thrilled to align with your efforts, First Lady, on Black infant mortality and morbidity.
Thank you, Ceil. Okay, from the Department of Human Services, Acting Commissioner Sarah Edelman is here. Commissioner, welcome, and please, would you introduce yourself?
Thank you, First Lady. Good morning, everyone. I'm Sarah Edelman, Acting Commissioner at the New Jersey Department of Human Services. At New Jersey Human Services, we provide services and supports for 1 in 3 New Jersey children and 1 in 5 New Jersey adults. And among the programs we operate, we offer childcare subsidies to families to help them afford childcare. And we operate the state's child care quality program, Grow NJ Kids, which is designed to help child care providers improve in important ways like health and safety, early learning curriculum, family engagement, and workforce and professional development. We also operate the state's Medicaid program. And as the First Lady talked about, we're doing a lot of important work in healthcare and Medicaid to support our moms and our families across New Jersey.
Great. Thank you, Commissioner. And last but not least, we have Jackie Boyette, President and founder of Modern Melanin Mom. Jackie, can you introduce yourself, please?
Hi, good morning. My name is Jackie Boyette. I am a full-time working mom of 2 small boys, 4 and 1 years old, and an advocate.
Awesome. Welcome, everyone, and thank you so much for taking the time to be here, as well as your very extensive, impressive, and inspiring work. Okay, so let's jump right in with our first question. What were the issues that existed prior to the pandemic around access to quality, affordable childcare? Jackie, I would really love to hear your personal perspective and experience on this first.
Sure. So before the pandemic, it was very hard to get subsidy. You have to meet a particular requirement. You have to work a certain amount of hours. You are just pressed to get the information really quickly. You have to enroll your child really quickly. Like, it's so many requirements that you have to meet to even qualify before you can even enroll your child into school. You always have the option to enroll the child, but what happens is you have to pay the full amount of tuition. For most people, in particular my family, we can't afford the full amount of tuition without subsidy. So we had to subsequently put our child in, pay the full amount, and then backdate to subsidy. That was pre-COVID. And then once COVID hit, we had to pull our children out.
Thank you so much for sharing. It is so important for us to hear personal experiences on this. Congresswoman, Commissioner, and Seal, could you share any thoughts you might have?
Thank you, First Lady. Yeah, in Congress, we recognize that even pre-COVID, we had serious problems with accessibility to affordable and quality childcare. And we recognize that when the pandemic hit, it just exacerbated all of the struggles and all the challenges that mothers had. And we also recognize the disproportionate and negative impact it had on women of color on two levels. One, the fact that we tend to be underemployed, period. And so the ability to pay for decent quality childcare was very difficult because of the cost of it. And secondly, we even represent a lion's share of the workforce that provides that care. And we ourselves needed subsidies, whether it's SNAP or other kind of subsidies, in order to take care of our families. And at the same time, our access to our jobs were either limited or eliminated during that period of time of COVID. So we've known for quite a while that that is an important issue, a very serious concern that has a disproportionate impact on women of color, Indigenous women. I mean, there are even 1 in 4 Latinos and American Indians that live in deserts, in childcare deserts. So this is a huge problem. It has huge family impact issues. It has huge economy issues, because if we can get women to work, if we can get their children, they can believe that their children are safely taken care of so that they can go to work, well, our economy benefits from it as well. So all of this thinking, this knowledge that we had was just heightened once the pandemic hit. And so I'm looking forward to having this discussion about what we did during the pandemic and what we need to do moving forward. But we knew that this was not a new problem.
Thank you. Commissioner or Seal?
I think the question is defined perfectly. And as the Congresswoman talked about, both affordability and quality have been two critical issues that we've been working on for the last many years prior to COVID. When our administration began, it had been over a decade since new investments and subsidies had been made in the childcare system. And we saw the needs that were there, and we've been very lucky that Governor Murphy and our administration have been able to make some significant investments in childcare even prior to the coronavirus pandemic. We were able to invest more than $100 million in the early years of our administration to substantially increase subsidy payments to help with family childcare costs and grant opportunities for childcare centers to make improvements in their facilities and in the training and curriculum for their staff and the kids that they serve. This helped childcare centers implement the new minimum wage laws in New Jersey as we phase up the wage, and it increased, in particular, it increased infant care rates by more than 40%. We knew that there was a real discrepancy in the level of care that needs to be provided for infants and the level of funding we were providing to our child care centers. So that was a huge investment that we were able to make, raising the monthly subsidy for an infant from $724 a month to over $1,024 a month in subsidies for some providers, and for our Grow and J Kid 3-star providers, over $1,126 a month. We know that children who are in quality early learning programs when they're young are better prepared for school and for life with things like reading and math skills. So these new investments that we were able to make even before COVID really put us on the footing that we needed to get through this past year. And we know that affordable, accessible childcare, quality childcare, and making sure that it's everywhere that people need it, and in the hours that best support our families, after hours, on the weekends, are still areas where we have a lot of work to do.
Excellent. Seal, anything you want to add?
Sure. Thank you. To the commissioner's point, I think New Jersey was on a very positive pathway. One of the first actions that Governor Murphy took coming into office was to look at childcare. And as the commissioner said, make an investment in childcare subsidy rates, look at the minimum wage, increase the minimum wage, and also for the first time, reward programs who improved quality on a scale that actually benefited programs that provided care to infants and toddlers in a greater capacity, because as the Congresswoman pointed out, New Jersey has childcare deserts, particularly for families looking for care for infants and toddlers. With about 67% of women of young children in the workforce, children, babies, and toddlers, childcare is a huge need. But as the Congresswoman pointed out, I think the pandemic also exposed some of the cracks in the system that had been existing for a long time. Childcare is a very fragile system. Talk to any childcare provider, whether they are center-based or home-based, they struggle basically to make ends meet. This is not a industry where you make money. It is a struggle. And I think as the pandemic revealed up front, once programs were closed appropriately by the governor right after the pandemic started, programs had very little reserves to keep them in working and to keep them whole during the pandemic. I think that, and to Congresswoman Watson Coleman's credit and our rest of our delegation that advocated strongly for the initial CARES Act funding, New Jersey used that funding very well to ensure that childcare could survive by changing how payment was made, by supporting programs when standards changed, and also by extending assistance to families who might not have been eligible. I think that was huge in ensuring that when childcare reopened, there were centers to reopen. But now we have a tremendous opportunity with the American Rescue Plan and the other great ideas and plans coming out of Washington to really take a step forward and reimagine the system for the future.
Thank you. We really need to have an understanding of the issues we faced even before the pandemic hit. Okay, so our next question is, how has New Jersey's approach to caregiving transformed since the beginning of the pandemic? Congresswoman, you want to kick us off?
You know what, I would like to defer to the commissioner, since we're talking about New Jersey centric, and I know why. I agree with Cecilia that our governor has prioritized issues such as this, which were probably neglected quite a bit the last 4 years before he came on board. And he found himself in the same situation that this current president is finding himself, which is to catch up, respond legitimately and appropriately to the needs of those whose issues had been marginalized. I'd really like to defer to the commissioner, and then if I can tag on anything that we're doing in DC helps facilitate what you all have tried to do, I'd like to do it that way. If that's okay with you, First Lady.
Thanks, Congresswoman. I would be happy to jump in here. Let me begin by thanking you. We have benefited tremendously in New Jersey and states across the country from the work that Congress has done to make sure that we are financially supported to take the steps we need to take to get through this past year and a half. It has been difficult and it has challenged and changed us, but we have had, particularly in the childcare space, we have had financial support from Congress to do the things we need to do. We have spent more than $300 million in new funding during COVID on childcare, and we have another $700 million now to go through the American Rescue Plan. And so that gives us tremendous flexibility in New Jersey to have the funds we need to take the steps we need to take. So thank you so much for your advocacy and your work to make sure that we have the resources we need. And I'd be happy to talk a little bit about the things we've done so far. So the first thing is that we have increased our overall investments in childcare. In our subsidy program, we have added an additional $125 million for subsidized emergency childcare for essential workers at the peak of COVID last spring through the surge, and providing state childcare subsidies to centers not just based on their current attendance, but based on their prior enrollment before the pandemic. We know that a huge part of our recovery is to make sure that our child care centers can be stable and be sustained through this. And attendance was lower during the pandemic. So we kept paying child care providers at enrollment rates rather than attendance rates. And that's been really crucial for our child care providers. We also waived parent copays in the child care subsidy program for parents who requested it due to impacts from COVID-19. We have offered COVID stabilization grants to child care providers, to all New Jersey licensed child care centers and registered family child care programs to meet the increased costs of reopening and remaining open, things like PPE and other health and safety measures they needed to take. We have made supplemental payments for subsidy providers to support the reopening and sustainability of child care centers. And we have made payment incentives so that child care providers prioritize serving children that are receiving the state subsidies. We've also created tuition support for school-aged children for families with incomes up to $150,000 a year to help pay for their care during the school day when they are learning remotely instead of in school and their parents are off at work, so that that kids have a place to go to do their remote schooling. So that was a huge initiative for us. And those who were eligible for childcare were able to use state subsidies to pay for care for children between the ages of 5 and 13 in that program. We've also, with our colleagues at New Jersey EDA, have worked on small business emergency assistant grants. More than 600 childcare providers have received over $6 million in grants from the New Jersey EDA. To help with growing their small businesses and sustaining their needs through this time. We've also worked with EDA and our Department of Children and Families on ways to build business capacity for child care providers across New Jersey. And we're looking to better understand the short and long-term challenges that our child care providers are facing in their business operations. And Governor Murphy also recently signed a law which provides $10 million in federal COVID relief for child care providers throughout New Jersey. So the funding has really been critical to the steps we've been able to take to sustain providers and to help families so that they have support through this time.
So if I can tag on to that now, because first of all, let me congratulate New Jersey and the Biden administration for providing the funds, and the Murphy administration for implementing such far-reaching, innovative, and compassionate care and response to the issue. I know that in the rescue plan, there was like $39 billion that was directed at this issue. And listening to the things that you all are doing, you're doing exactly what we envisioned, at least those who are, in our caucus envisioned, that would be used to not only help families be able to go to work if they could, or at least have support for their childcare needs, but the childcare industry itself, which Cecilia has mentioned, is not an industry that is a profit-making industry. It's barely holding on. So we did look at this industry from the need of the individuals that would benefit from the service, the family and the child, and the child care provider as a business entity, small, making sure that there was money that was there specifically for them. Even moving forward, and I mean, as a result of that, I think New Jersey got something like 6.94 billion to implement these issues. And I know moving forward that we're still thinking about this, that not only are we thinking about this through the budgeting process and what we would do as line item funding, but we're also looking at this in terms of the American Families Plan, which is a unique infrastructure approach that recognizes that to get the economy back, to build the infrastructure, we got to build the family as an infrastructure. We got to support it and build it up. And so while there's something like or $225 billion that's been identified by President for those initiatives, looking at the industry as well as the people who work and need the support, looking at the wages and the stabilization of standards and access to unionization, et cetera. Things New Jersey already is doing, thank God. I'm part of the Progressive Caucus, and while the proposal in front of us is about 225 billion, we're looking for like 700 billion over a period of 10 years, because we think the need is much greater than we're addressing in this proposal right now. And so I think that is our responsibility, and we're trying to fulfill it to the extent that we can. And that is to provide the resources, to provide some guidance on how it can and cannot be spent, but also to work with strong partnerships with states like the state of New Jersey, as you all advance these initiatives on behalf of the families and the children and the industries that need it, that will help us not only be healthy and strong physically, emotionally, and health-wise, but also help build our economy and our revenue in our state of New Jersey so that we can continue to flourish.
Thank you. Seal, I wonder if you wouldn't mind talking a little bit, and also, can you give a shout out for the pilot project that we're working on together in partnership here? Because I think that this just goes to prove that New Jersey is doing everything we can, not only at the federal level with the Congresswoman in Washington, but also in the state with Sarah and her team. And then there's a lot of other people who are coming together on the ground to try and really think out of the box and how we can move forward here. Is that all right?
Yes, and I think New Jersey is doing so many positive things. I think the work that you and Nurture and Jay have done, these are all connected. We're talking about, to the Congresswoman's point, how do we support families the best way that we can? And I think that certainly the Department of Human Services has used the federal money extremely well to ensure that childcare survives. And it is, as the commissioner pointed out, it is broad-based. It's supported programs, but it's supported families too. And to New Jersey's credit, we've extended those supports and continue to do so. Many states did it in the beginning and did not continue. But we are facing incredible challenges. And I think the top on the list is the childcare workforce. Many people left during COVID when programs closed, and centers have not been able to hire them back. They are competing, as a number of childcare providers have told us, they're competing with Costco and Amazon, who are providing a higher wage and healthcare. Most of our childcare workforce does not have healthcare. So I think that in looking at how we build back a stronger system, focusing on the workforce, how do we ensure that people are prepared and are supported appropriately? Certainly the minimum wage was a significant step for New Jersey. Other states are just thinking about that. The fact that we have that is positive. But this is an industry that I think is as essential as police and fire and teachers. We need to look at how we develop over the long term a strong, well-compensated workforce. That's how we think childcare can survive. And again, thanks to the work going on in Washington, hopefully there will be federal funding to help at least start that process.
I think the American Families Program plan that is being put forth, where they're talking about 225 billion and we're talking about $700 billion, recognizes that. And not only does it recognize the standardization of these work environments, but also the elevation of their wages and their benefits, including access to healthcare and family leave and things of that nature. Because those jobs are principally done by women of color. And those jobs, which pay less than many other equally valuable jobs in our society, return an investment, a lower investment in our minority families. It adds to the wage gap. It adds to, the frustration, discrimination that Black women in particular and Latina women in particular experience. So the money that is being proposed, or the efforts that are being proposed in the families plan, look at not only work conditions, but even access to training and other opportunities. And I need to say one other thing that I think we've been helpful with, and that was expanding the earned income tax credit. And by doing that, and the child tax credit, I think that both of those things have worked to take thousands and tens of thousands of children out of poverty. But that's only a first step. And everyone is sort of teetering on the brink of, we can go back or we can go forward. And now we see this opportunity, and we know that we need to go forward. And because there seems to be this quote unquote shortage of workforce, people who are available, the only people who are available, who aren't available to people who want to pay them less than a minimum wage, less than a decent wage. And so even there was a recent story in the paper where this company that I can't remember what it was trying to get people to come on board for $7.25 and tips. I think it was an ice cream place or something, and didn't get any takes. Decided to advertise again at minimum wage, $15 plus tips, had 1,000 applicants. People need to work to be able to take care of their families. And we need to recognize that in many instances, although New Jersey is moving in the right direction, in many instances across this country, that work that we do, that Black women and Latina women and others do, has just not been valued to the extent that we can do anything about that wealth gap, take our families into a healthy environment, have no need for SNAP or Medicaid or any other kind of sort of state support system, but be able to participate in the system as a fully employed a member of our society. Building back, First Lady.
Yes, understood. Sorry. So listen, I just wanted to just, underscore everything that's just been said. And Seal also didn't, she kind of left out one piece of this, and just to give you some context here, New Jersey Pandemic Relief Fund, in partnership with Seal, in partnership with United Way of Northern New Jersey, in partnership with others on the ground, are really looking at an innovative way to approach childcare. And I think it's something, hopefully, we're going to find out with this pilot program in a year or two, that it really has legs, and it really will impact, Congresswoman, our women of color, especially because it's especially focused on how we can absolutely blow up the model and make it more accessible and more profitable for more players, and particularly our women of color. So just wanted to throw that out there. So as we move forward, I obviously thank you all for those answers. It gives us a much fuller picture of the current status of the childcare industry. So looking ahead, how can we continue to invest in and transform caregiving in New Jersey, both to address the pre-existing issues and the impacts of the pandemic? Sarah, I'm not sure if you have anything else to offer. You just gave us such a laundry list of everything you're doing, but maybe it makes sense to start with you again, as you are here in New Jersey.
Of course. And I just to echo some of the comments with some data about impact on women and women of color, I think we've all seen the data that nearly 3 million women left the workforce during COVID, largely because of childcare issues. And I think that's a huge part of how we think about our economic recovery, is investment in childcare that helps women get back to work. The other piece of that is the women who own our childcare centers. Nationally, 95% of our childcare centers are women owned, and 45% are women minority owned childcare centers. So when we talk about the labor statistics around all of this, the childcare issues both impact women across our state, but but the people who are running our child care centers and the women who are working in our child care centers, it is a largely female workforce and a significant minority workforce. So I just wanted to circle back on those points with some of the labor statistics. I think to your question about how we continue to invest and transform as we transition out of the pandemic, at this point in New Jersey, just over 80% of the childcare facilities that were open before the pandemic are open and operating now. We've heard that many of the centers that are still closed plan to reopen at some point. So I think that going back to some of the points that Cecilia and others have made here, workforce development opportunities, training, building a career path, all of those are important. In addition to a fair wage for our workers, is really investing in their workforce development opportunity and the ability to grow over time. We also, for our department, a huge part of our focus will be continuing to grow our quality program, the Grow NJ Kids program, so that we can assist providers to become the highest quality providers for our system. We continue to make investments in pre-K expansion and opportunities, and this is sort of what Jacqueline touched on at the very beginning. We have some work to do in our partnership and our coordination with between the childcare industry and our schools, our after-school programs, Head Start. We want to maximize availability and ease the burden and the process for parents, no matter what door they go through to access childcare. So those will be important things to focus on as we transition out of this public health emergency. And then we also have some opportunities to do more with our home-based childcare providers as well. So I think there's plenty of opportunity for us to use some of the new federal funding that we have to continue to move forward the same priorities that we had before the pandemic. I will say one of our key challenges in how we think about this is that there's a ton of federal financial cash infusion to the state right now, but that money runs out. And so we are facing a cliff for our state. If we're able to invest those funds in increased wages and things like that, it will be very difficult for states to make up those billions of dollars in funding just in state dollars once that money runs out. And so I think that's another key area for us to partner with Congress and with President Biden's administration, is how do we make the changes that we're investing in now financially sustainable over time after these COVID dollars run out.
Congresswoman, I don't know if you want to answer. I also would love to get Jackie in here as well to hear our mom's perspective, because we can't do any of this without our moms.
Yeah, I was gonna say I wanted to hear from Jackie as well. This is really an important discussion because we recognize the significance of women in bringing back our economy in a fair way, but also ensuring that our family structure is strong. No family should have to pay 56% of its income for childcare. So we've got to find a way to sustain the kind of affordability as well as accessibility to high quality childcare for families, recognizing that somewhere less than 10% of their income should be going to childcare. So there's no incentive for them to be working. That doesn't make sense for them to work if more than half of their income is used for taking care of their children. And that's not including getting back and forth and getting them and all those other things. We really need to ensure that childcare is high quality, accessible, and affordable. And I think that this president recognizes that and speaks often to, I don't think a family should have to pay more than 7.5% of their income for childcare. That's a goal that we need to try to translate into a reality. I think that, and we're not really talking so much about that, but I think that the two infrastructure programs will help us move past the pandemic But past the first year, the second year, the third year, those are 6 and 8 and 10-year programs where we'll be increasing jobs, better paying jobs, training, emphasis on people who are underemployed, undertrained, undereducated, making sure that we can build and sustain an economy that takes families out of poverty and puts us all on a sure footing. So I agree with the commissioner. You know, this sort of like surge of money may stop in one regard, but the infrastructure programs, both the family and the jobs program, should take us through some sustainability that builds an economy over that period of time where people are working, earning decent incomes, and able to support their families and take care of their child care needs too. I hope that doesn't sound too pie in the sky. I think that's why I'm down there, and that's what I hope to see.
Jackie, do you want to add anything, or you want to hold off?
No, it's okay. While everyone was speaking, I was just thinking of compassion. So this has to go. Like this money is temporary, right? Like we're it's a COVID situation. We're in a pandemic. It's like chaos. Like let's get us back to where we were. But it has to have longevity for any family to sustain, in particular Black and Brown families. We're going to get 5 years from now, and we're going to bump into hopefully we don't bump into the same issues that we've been bumping into. Like I said, pre-pandemic, it was even just, like I said, 50 cents over, and I couldn't get subsidy. I just don't want that to happen to families again. Like pandemic was a temporary situation. We're getting back, we're going back to work and things like that. But I don't want families to struggle. Like, I don't want families to get where they have to be like, I have to work 2 and 3 jobs and I don't have anyone to take care of my child. I want to procreate. I want to have more babies, but I have to think about, okay, if I have another baby, am I going to be able to afford my rent? If I have another baby, am I going to be able to have a car? If I have my baby, am I going to be able to afford Pampers, wipes, all these things? So you want to have a family structure, but then you think all this money is good now, it sets me up now. But what happens if another baby comes? What happens if, administrations change? It has to be something that you feel comfortable and you feel safe in. You want to live in New Jersey and feel safe that if I have all these resources, are they going to be snatched away from me? And I think as a parent, that's what you think about. You don't think about, yes, you think about the right now, but you think about if I have another child that is entering preschool or kindergarten, and the cost of living goes up. So if my rent is now $2,000 and then the provider's rent goes up, okay, now am I at $2,000 for childcare? Am I at $2,400 for childcare? You think about all these things, and I just hope as a mother that 10 years from now, 15 years from now, even 5 years from now, that this is sustainable. Like Congresswoman Bonnie Watson said, that is sustainable, that it doesn't just affect, families, in particular, white families, that they thrive, but then Black and Brown families fall to the side again. Black and Brown families, which are mainly single mothers, it falls back to the side again. I just hope as a mother that does not happen. And I hope as an advocate that does not happen.
One of the things that I wanted to just raise to remind us, Rosa DeLaura, who is the chair of the Appropriations Committee, has fought for this. It's the child care tax credit. It is something that was introduced during COVID, but Jacqueline, it is also something that we're going to make sure is permanent. And that in and of itself has helped to help families and help take families out of poverty, particularly children. That is a tool that we hope that is part of the sustainability of particularly Black and Brown women having a chance to work, to provide for their families, to train for new jobs, and to participate in the jobs that are going to be created by this workforce infrastructure program and training. And so you're absolutely right that we need to look beyond here and what needs to be sustainable in order to ensure that our families can decrease the wealth gap that has been so persistent and has just grown so much so recently, like it's enough, stop it now, and let's move on in the right direction.
Seal, anything you want to add or?
Yes, I just want to second what the Congresswoman said. The child tax credit is huge. It's a game changer. If it is continued, it is right now for 1 year. If it's continued, it can eliminate poverty for a significant percentage of families. So as advocates, we're committed to starting right now to make sure that it is sustained and continued past this year. In listening to Jackie, I think you are so right. And I understand the fear about how do we use this huge investment that's been made that is going to end in 2 years. But this is a chance, I think, to build the infrastructure. It's a chance to build on what the state is already putting in place. The payment process that's switched from attendance to enrollment, which is stabilized centers. How much would it cost to continue that in the future? The issue of ensuring that families at a higher income level can receive subsidy. And we're not talking about a high income level. We're talking, these are families who still struggle. Is there a way to extend the benefit beyond the current eligibility standards to build in some copays for higher income families? I think this is a chance to try some innovation. You pointed out the initiative of United Way. That the Pandemic Relief Fund is supporting, that can be a game changer for family childcare, which many families are now looking at as a result of the pandemic, maybe looking at a smaller childcare setting. I think this is a way to make those investments and build that infrastructure for the future. It's too good a chance to miss.
Thank you so much for that. I fear we're running out of time, so I'm going to give one more question really quickly. I think we have to acknowledge that there are more than 9 in 10 of our early childhood care providers and educators are women, and more than 4 in 10 of them are women of color. So I'm just wondering what changes can be made to support specific challenges faced by Black women or women of color who work in the care economy. Anyone want to kick us off?
I would start with healthcare. I think we have heard over and over and over about the need for healthcare. That these are, if you think about the women, as primarily women of color who showed up every day during COVID to provide childcare to families, they put their lives at risk, right? They don't have healthcare. States are looking at, are there innovative ways to create a healthcare system that would support this workforce? I think we have to look at that. And also some short-term solutions. Can we reward providers, staff who worked in centers during the pandemic? Can we create a bonus for them to sign on and come back to work? I think, again, these are one-time initiatives, but might be an important step forward.
Well, I certainly agree with everything Seal said. I also think that we need to recognize that these entities, these small businesses, these maybe not so sophisticated businesses have not had the kind of access to small business loans or grants or things of that nature to build upon their infrastructure, to support and provide even more services. And we need to be able to ensure that they have access. They have access to grants and they have access to loans, and that along with healthcare and other benefits that they should be able to provide, and that they should be able to make a livable wage themselves. Because during this pandemic, many of these childcare centers providers have used their own credit cards, have gone into their own debt to try to keep things going, as well as having had their employees contribute to the sacrifice with lower wages or whatever. This industry is much too important to our future, and we need to treat it as such and give it the kind of access to resources that other industries that we value and other small businesses, and to recognize it is a small business and support it in kind.
Just echoing the Congresswoman's point about small business loans and grants to childcare providers. I think that's right, that a lot of these childcare providers don't have a lot of experience applying for grants to government. And so part of what I think it's really impressive what New Jersey has been able to do, our Economic Development Authority is offering these small business grants to childcare providers, but we're also providing technical assistance to providers so to give them help to apply and help to do once they have their grants, technical assistance to implement the kinds of things that will be most beneficial to take advantage of these opportunities. So I think that's a wonderful point. I'm very proud that New Jersey has been able to take some of those steps and do some of these things. And I think that broadly, the things we've been talking about here to continue to address the wealth gap, equal pay, and continuing to address things like structural racism and bias and discrimination to ensure that women of color are treated fairly and given the same opportunities to open businesses are really important and things that we prioritize as we work with our childcare providers. And just really back to this question of wage and compensation, we are continuing to tie our wage increases in our childcare payments to the increasing minimum wage. But we know that we need these wages to be competitive, that this work is in some cases more difficult than other jobs that are paying the same rates. And so we have to take that into account as we think about how to continue to increase funding for wages for our childcare workforce.
I just wanted to jump in here for a second and say one thing, and this is related, it's tangentially related, but I know, Jackie, you were just talking about the pandemic and how we're recovering from the pandemic. A lot of what we're talking about are long-term improvements, and they're going to benefit the system enormously as we move forward. One small piece of this puzzle here and now that I just would feel remiss if I didn't throw this out there is we must encourage every person to get a vaccine. And I say that because we are coming out of this thing right now, and touch wood, our numbers are in a good place. Our hospitalizations are coming down. Thankfully, our deaths are coming down. But I will tell you, and I know Sarah will jump in with both feet on this. There are variants in other places in the world, and just because we can all get together now and be outside and be socially distanced and be in one another's company, that does not mean that through cargo ships and passenger planes and other means that these variants and new variants are not going to come to our shore, to our state. And we don't want to find that that's the case. And come October, November, when we're going back inside, we land ourselves back in a challenging space. So Sarah, I would love to have you, if you can, just give one little plug for this, and you're wearing your Department of Health hat, and then we can, finish off if anybody else has any more comments. Thank you.
Sure. As the First Lady just said, we're in a great place in New Jersey. We have over 72% of our state, that's more than 5.5 million New Jerseyans, have received at least their first vaccine. So thank you to everyone for rolling up your sleeves. But she's also absolutely right that we can't let our activity slip either. We have to continue to be vigilant and be careful and encourage people who haven't been vaccinated to be vaccinated. We see these variants coming up, and we also, there are a lot of myths out there, for instance, that the vaccine is not safe for women in childbearing years. And we know a lot of our childcare providers and our workforce are women in childbearing years. And so as we think about, getting back to full capacity and people, going back to their normal lives, we don't want to slip back into higher COVID activity because the workers in our childcare centers and all across the state are not being vaccinated. So I would just share the same plug. Please, everyone, be vaccinated, roll up your sleeves and do your part.
Okay. Thank you. All right. I want to thank our incredible panelists, Congresswoman Bonnie Watson Coleman, Commissioner Sarah Edelman, ACNJ President and CEO Cecilia Zalkind, and of course, our New Jersey mom, Jackie Boyett, for your time, their time, and thoughtfulness in responses today. I also want to thank everyone who is with us virtually and hope that you will share this video with your networks. If the pandemic has made one thing clear, it's that our families, our moms, our communities really need our support. And if we're going to bounce back to our full capacity, we will have to prioritize the care economy and come to understand the vital role it plays in our success as a state and as a nation. Here in New Jersey, we are ready to lead by example. Again, I thank you all so much for joining us. Bye, everybody.